Harris Medical Center, and it's always a great pleasure to get to meet new people. And Dr. Rick Toothaker has joined us, and it's always our pleasure to get to talk, interview, and put your face with a name and tell everybody all about you. And we'll let you start out by telling us a little bit about you, where you're from, tell us a little bit about education, and how you got to Searcy in Newport, Arkansas.
Sure. I'm originally from New England, from Maine, and trained in the Northeast. Did medical school at Dartmouth and training in New York and Maine, where I'm from, and I've been practicing for 12 years, and a few different places, but for the most part, been pretty consistent in practicing in more rural-based practices, kind of more general community oncology, and again, in part because my interests are, in the outdoors and activities and what have you, and so that's been in part why I've targeted those particular places to live. And I think why do I choose that particular? In addition, I've targeted places to practice where kind of the quality of the resources to be able to practice are where I need them to be. So, that I think is historically been the challenge, to find more rural-based practice where you don't compromise quality, and so that can be tough. But I think with Unity, I've found that kind of that happy medium to be able to live where I want to live, but also to provide the quality care that I expect from myself.
Very interesting that a man from Maine would end up in Arkansas, and but it's a great story. And let's talk a little bit about your family. Did you bring family with you here?
I did. Married, 5 children. Oldest is in college, so 4 with us. And they've acclimated very well, making friends, enjoying school, at least when they're in it. So everything so far has been very, very good.
You mentioned oncology, and you're an oncologist, and people will ask from time to time, they say, most people will say, what is an oncologist? And I said, well, that's nothing. It's an oncologist. What it is. Tell us exactly what that is. Tell us what that training is, because most people don't know.
Sure. Kind of as a step back, oncology is treatment of cancer. And most oncologists in this day and age also do hematology, which is kind of dealing with the blood. And so especially patients that are coming for blood issues, they hear they're seeing the oncologist and get petrified, but we do both. And a lot of blood problems are benign and not necessarily cancer related. So I do both of those things. But really it's just evaluation and management and treatment of cancer is what that word encompasses.
Why being a doctor and why being an oncologist? Where along the way did you decide, man, this is something I think I want to do?
Sure. Going back in time, my interests were, as a kid and growing up, I liked science, and that was my particular passion in life, and being a physician and taking care of people certainly fit the science part of things for me. And then beyond that, as far as oncology specifically, my own family history was my father's side of the family. Both of my grandparents had cancer, and my father did as well. And so I personally got a chance to see a variety of oncologists, and to be frank about it, I saw people that I thought that did a good job, and then I saw people that I thought didn't do a good job. And so I think oncology is a unique practice in that it's a different relationship with the patient, and I think there's just a different level of interaction and being able to hopefully display compassion and care for people in what most people probably define as the worst possible diagnosis and situation they can deal with. And so, again, when you deal with it personally, I think it hopefully makes you a little bit more able to have empathy and provide that sort of care. So that's why I got into it.
Well, I think we as human beings, when we hear the word cancer, we first think worst thought scenario that you could have, and you need people out there that can kind of give you some reassurance that, sometimes it's not the worst case scenario,
Yep.
and that's what you do.
Yes.
Talk a little bit about people in general and the successes that you have, and how people feel from the fact when they first come to see you and they go, oh my goodness, this is not going to work, and then, oh my goodness, it did work, and how that makes you feel, and how it makes them feel.
Yeah, I guess I see myself as, to some degree, a counselor in the sense of having the background information to work with, in the sense of making the diagnosis, getting all the pertinent information to help assess prognosis, just mean, what are our goals of treatment? Is it to cure? Is it to try to control disease? What are the best treatment options to facilitate that? And then there definitely are times where a person has a situation where they need, kind of the next level of care. And I think that's one of the good parts about Unity, is having that Mayo Clinic affiliation. It really allows for me to have access to subspecialty physicians that only focus on rare, less common cancers, and are doing research, clinical trials, where if that's what's necessary for the patient's care, we have pretty direct access to that, as opposed to putting in a referral and waiting a month for them to eventually get a foot in the door. So it's basically trying to guide people through that whole process based on the information that I have, and trying to give them the best information to make those decisions. Because ultimately, the decisions that people make on how to manage their cancer or otherwise, they have to live, usually what I tell patients is you have to live with those consequences. So you have to be part of that decision making, as far as, how to treat something, and how aggressively or unaggressively, and where to have that treatment done.
Well, we appreciate you taking time to join us, Dr. Toothaker, and we welcome you to Unity Health Harris Medical Center in Newport, Unity Health overall, and obviously a great addition to us here in Newport, Arkansas. And I guess you come, how often do you come here?
Right now, every other week. As time goes on, that may be more frequent. So.
There you go. Well, we appreciate him taking time to join us, and what a pleasure. I enjoy visiting with the folks at Unity Health Harris Medical Center. These are good folks, and you'll enjoy it. A guy from Maine in Newport and Searcy, Arkansas is mind-boggling to me, but we welcome you, our fine friend, to our fine cities.
Well, thank you. I appreciate it.